Oops, I've got you in Tredellenberg. Okay, are you gonna pass out?
No.
Let's put you back. That is so fun. Okay. So, HydraFacial is exfoliation and infusion. So the machine scrapes away and sucks up all of the dead skin cells and congestion and dirt and grime and yuckiness, and then it infuses a bunch of different things during the procedure. One being hyaluronic acid, the other being other different acids to break up different skin cells. So actually, where was I? I'm going to protocols. We're going to do, platinum is for lymphatic drainage, deluxe has the booster, signature has no booster. Are we doing a booster today? I recommend it.
Yeah, sure.
There's a little price difference, but you know, model pricing makes it more palatable. So it says start by cleansing the skin. Did you wash your face this morning?
Mm-hmm.
Awesome. So I am just going to alcohol a little bit. Do I have any alcohol?
Right there.
Am I blind? Oh. So just close your eyes. And I always tell people this is like not your normal facial. It's not going to be, you know, aromatherapy, music, and relaxing. It's meant to be medical, so it's meant to kind of pull and tug at your skin and have offensive alcohol smells that make you cough and all the things that estheticians don't do and probably are horrified at. Oops. But we do have warm towels, so that'll help. All right, so they can wash their face in the bathroom, then we alcohol, and then I'm just going to follow the directions. This is the hand piece. These are our 4 solutions. Right now they're all in the off position, which is great. The first thing we're going to do, so you can read all of this, and I like to tell the people the facts. So the fact says your skin takes 28 days to regenerate itself, which is kind of cool. And then as you age, cellular turnover slows down, which is annoying. So it says use orange or purple aggression tip for somebody who's had multiple HydraFacials. For you, this is your second, you said?
Yep.
Okay, so we're gonna stick with the blue, orange, or purple. We're gonna stick with the blue top. Actually, how did you tolerate the last one?
Really well.
Okay, so we're gonna go a little more aggressive today. I think that'll be okay. So our tips are over here. And the machine tells us what to do. Orange is a little bit less aggressive than purple, so we'll start with orange today and then maybe purple next time for her, especially wedding prep. She really wants to like shine, literally shine. Okay. So this will tell you what to do, and then it'll tell you the pattern if you click on that. So this is just dots, and then you dot the solution on, and then you feather it up and out. So this is the pressure. So I can go up a little bit, or I can just leave it as is since we're using a new tip, and then I turn it on. And we're using the active 4, which is here, so I'm gonna turn that on. I'm gonna test it with my hand to try to get the solution flowing. If it doesn't flow well enough, I can turn it towards the plus. If it flows too much, I can turn it towards the minus. I just want it to, there we go. So this tube goes toward the back. This is the collection tube, so it'll collect all the gunk and all of the solution. All right, and the other thing I want to get is just another towel for So I like to do that so I can see what I'm doing. So right now I'm just depositing the solution. So about every centimeter, I'm gonna put some. And this starts kind of eating away at all of the dead skin cells. The active 4 has glucosamine in it, and then something else, I can't remember. So now that we've deposited, I can kind of rub it in a little bit. Just make sure all of the skin is covered. We want to stay away from inner orbital rim. Just make sure to get everywhere that, especially areas that look congested. And then I'm going to actually clean it up. So now I'm doing the exfoliation part. So it's pulling all that liquid off her skin plus all of the dead skin cells. And it's still infusing the glucosamine, so it'll continue eating up all of the congestion, which is good because the more steps we do, the more it'll pull, which means the more effective. So you want to make sure you get a good suction so the nose can be a little tough. But the nose is usually the most congested, so I like to like smash down and make people uncomfortable. Because that's what you're looking for. You're looking for results.
Exactly.
Otherwise, you'd go to a nice floofy place. I always tell people, like, I'm the most direct person in action and verbally. I may not be the most floofy and the most fluffy and cloudy, but you'll always know what's going on in my brain, which is not a bad thing.
No.
My kids might say different. So the way to check to see if the fluid is still flowing is there's the fluid line. If you ever feel like it's not, I always check on my hand too. And you can actually see the fluid itself is kind of drying strangely on the glove, so I don't think it's eating away at the glove. That's not possible, but it's not just water. I just want to turn this up a little bit. When you're doing a HydraFacial, the goal is to do 50 mLs of liquid or less in the canister. So one of the things you want to watch for is having too much liquid dripping all over their face. Not only does that lead to product loss that's expensive and unnecessary, but it's also uncomfortable for people to have liquid running down their face and in their ears. So we want just enough, but not too much. And if you kind of follow the techniques that I'm showing you, you'll hit right at 50 mLs. If you hit more, it's just something you want to look at every time. If you're at more than 50 mLs, you just want to edit how much fluid is coming out. There we go. That's a little better. Okay, so she's a little pink. I like that. Things are already working. Perfect. Now, once you start midline and out, so that's one of the instructions. So I turn this off, and then I move forward, and now it says Glycol. You're going to use the teal. So there's no Glycol here, which is how I know it's one of the tubes. So I take the orange tip off because she's already been aggressively exfoliated. So the teal tip is mainly for infusion. And actually, if you inspect the tips, you'll see that they look different and they feel different on your hand. So I'm gonna find, sometimes they're here, sometimes I have to grab a new one. Looks like I have to grab a new one. So this says glycol peel. It's a powerful combination of glycolic and salicylic acids, and so that again is chemical exfoliation. We just did mechanical exfoliation, so this is chemical, so it kind of just breaks everything up chemically. So I push this off to the side. That's the suction, so I'm not sucking with this one. So you'll notice it's a little more goopy. So I wait till it clicks in, and it says short feather motion, continue to apply counter pressure, don't rub or dab or spread onto the skin, teal, and short feather. So I'm kind of dotting on the nose and then feathering around the face. So I have to turn it on. There we go. You're supposed to use about half a tube. So this is going to be goopier than you think it is. In order to use, I always find people always use less than they should. So it's depositing a good healthy drop each time I do it. And the short feathers are like this with counter pressure. And this is one I do like to make sure they're not dripping into their eyes. You can do wet or dry little, what are they called, pads on their eyes if you'd like. And I have a couple of warming towels for after in the warmer, which I have to get another one in here. I was just telling Olivia I need to get another towel warmer in here. So I'll order that. So you're supposed to start with lower faced and then move out from midline. But I just want to cover all the surface area with this stuff. And she's dripping a little bit. That's fine with this one because, like I said, people underuse this one. And actually, you can tell when I look close at her pores, she does have bigger pores, but they look really good. Edie, like,
that's very nice.
You know, not congested hardly at all. And I know we just did the exfoliation, so but the fact that they responded so well to the orange tip means that the last one worked.
Awesome.
So the big thing for patients after that is to make sure to recommend home care so that we keep those pores closing down, because the more closed they are, not only is that aesthetically pleasing, but also it keeps them from getting gunked up again. So Beta HD is a multi-action specialized skin solution for exfoliation. So now that we have the acid on there, the peel, we're going to change it back to exfoliation again. So we'll put the suction back on. And it says teal, so we're going to use the teal. We're going to turn off the active 4 and on the Beta HD. We'll stick with 22, and then suggested patterns are just in lines, so we'll do that. And, looks a little goopy. There. So this is longer than those feathers. So big things I send people home with who have bigger pores are mud mask is great for at home chemical exfoliation, acid exfoliation, because it has glycolic, and citric acids in it that are mild enough to use on a 2 to 3 days a week basis. And then the Aha Baha cream. If you're going to do the whole system, doing the cleanser as well will help with exfoliation, but the cream I find is great because unlike the cleanser that you just wash off, the cream stays on, so it goes on after you wash, after you tone, if you tone, and then before you put your moisturizer on, and it continually directs that exfoliation into your skin overnight. I think it's meant to be used twice a day, but I only use it once a day because I'm lazy. I find most people, if we're going to get you to be compliant with skincare, let's just plan on once a day.
Right.
The companies want it to be twice a day because that's how they make their money. And then as far as the glycolic, the lactic citric acid mud mask I was talking about for 2 to 3 times a week, I put it on right before my shower. And that's how I stay compliant with it because it's kind of messy. It works really well, but I won't do it. I leave it in my shower and I put it on in the shower and then I take it off in the shower, and that's the only way. I found little tips and tricks for myself because I'm super busy and I get bored easy, so doing things like that is boring to me. I don't know, I'm kind of crazy. All right, so now we're done with beta HG. I turn that off. Move forward. Now we're going to rinse the machine. So I'm going to take the teal tip off. Olivia, would you go grab the couple of the towels from the sterilizer thingy? Yeah. So this is the rinse cap. And then all of this is off. I've flipped the rinse away on, which is almost empty, so I'm going to keep an eye on it. And then press start, so it's going to rinse the tubing to get all of the gunk out. And then while that's happening, we're going to take a wet towel and neutralize all of the acidic components in the beta HD and the glycol with a wet towel. So you can use a cold wet towel if it's hot in the summer, or a warm one if it's a little bit cooler, which it is today, although it's pretty warm in this room. And then it'll pull up the next thing that we have to do. Awesome, thanks Liv. Not great, huh? The warming function of the sink was not working as well as it normally does. So we just run over the skin. Yeah, really your nose is the only place that was congested, and it's looking better already, so.
I saw such a huge difference after the first one.
Good. Oh, that makes me happy.
Just like stubborn acne that had been there for so many, almost like years, it felt like.
That was
gone.
like finally moving.
It was amazing.
Ooh, I like that. All right, so now it says clear tip. Grab that. So I have the rinse away on. I like to stay on top of these switches because otherwise I forget. So we put the clear tip on. And it says choice of booster. So we're going to put the booster in. So we're going to take the suction out again. And let's see. I'm going to decide what kind of booster. Right now, I want to do Regen GF. This has human growth factor in it. So this is good for fine lines, wrinkles, reducing pore size, thickening skin, getting wedding ready. And you're going to use about 1/3 of this tube, so you're going to be a little bit not as goopy as before. And kiss and twist is the pattern, so I'll show you that. So I don't want to be as goopy as when I had the glycol in there, but I want enough that, so kiss and twist, like that. Oh yeah, that's good. A little bit more. There we go. I want it to almost drip off. See, a little bit dripping. I want it to almost drip off her face because I want enough that it's going to penetrate. There, perfect. Turn it down just a tiny bit again. I think I hear Adam Levine. He's my favorite. I saw him in concert once when I had my little baby. It was for New Skin Conference, which is one of the product lines we sell. And so they always, it's a big conference once a year. And so they always hire whatever musician. And that year it was him. And apparently there was a chance he wasn't going to go on because I think he was hungover or drugged out or something. I don't know. But he needed doctors and he had a fever and he needed IV fluids and antibiotics. Right. You had a fever or a hangover. But anyway, he went on and we were in the first row. I was touching the stage. I didn't have a sitter. I had my little Holland with me. She was 4 months old. And Tori Spelling was there, and she had gotten a sitter for her little one, but they got delayed, so they missed their flight. So they had the sitter there without Tori Spelling's baby. So I'm like, I'll use the sitter. And so she came and watched Holland while I went to see Maroon 5. It was the best. It was probably the best thing ever. The only sad thing was that he was not obviously in his optimum condition. Like, I feel like if I had paid for a ticket, you know, he probably wouldn't have been so annoying the night before or the day before. All right, so we'll turn that off. So we're done with the booster. And now it's the lighting. So I can take the booster out. I'll put this back in. All my switches are off, which is good because I'm not using any of them. The lighting is blue or red. Red is for blue is for acne, red is for anti-aging. So we're gonna do acne because this gal is not old enough to need anti-aging as much. So you hold the lights and you can push start and it'll time you. So you just kind of sit here for 30 seconds. You're supposed to also, yeah, there we go. I'm gonna put some goggles on you. Are these upside down? No, they're universal. So like I said, blue is for acne. It's supposed to kill bacteria. And then red is for stimulating blood flow. So red really wouldn't be bad for anybody. I mean, part of helping acne is stimulating blood flow to, especially if you're on somebody who's on either systemic or topical antibiotics. If you have blood flow, it's really going to penetrate all of that topical or the systemic antibiotics to the area. Any booster we've used or any sort of serum we've used with blood flow is going to locally increase the uptake there, so it's not a bad thing. But if you want to focus on acne and blemishing, we use blue lights. Alternatively, you can use one hand blue, one hand red, and then just kind of switch off and make sure you cover the whole area. You're supposed to sit here for 30 seconds in one area. I get distracted while I'm talking, and I don't do that. It doesn't harm anything as long as you're moving around and not just sitting on the forehead the whole time or whatever. So we have about 2.5 minutes. And while that's going on, the booster is drying, which is good because we want that to sit on there as long as possible because her skin is nice and wide open. Think about after a shower, you are the most accepting to moisturizer. So sometimes after you shower, if you put moisturizer on, you have to put it on again because you feel like your skin soaks it up. It really does. And it's because all of your pores are open, the blood flow is there, you're nice and warm. And so the moisturizer just kind of does sink a lot deeper than if you're really dry and flaky. Your skin doesn't accept the moisturizer as well. And the flakiness is a barrier of dead skin cells that prevents moisturizer from getting into the healthy tissue. So same thing with this. We've got you exfoliated twice. We've got you infused with acids. And so you're a little pink from being aggravated chemically and physically. So you're right now completely primed to take up all of that regen, which is the human growth factor. It's all good stuff. This light can't hurt eyes. It's just you don't want to. The goggles are nice so you're not blasting them with flashlights like my kids do at night. Do you have kids, Edie?
No, one day.
Yeah.
How many do you have?
I have 5.
Oh my goodness.
Yeah, they're monsters. They're good kids though. That's why I started all this. I was working in the hospital as a hospitalist, rounding on admitting and discharging patients. And after we had had our third, it was just, I couldn't manage the hospital hours. So I moved to do acute rehab, which was hospitalist work, but in a rehab center, even an acute one, they're not hospital grade, they're not acute care, it's more post-acute care. So in theory, you know, at least 75% of your patients are fine.
Right.
And then 25% have some sort of medical emergency. So it was supposed to be mother's hours. No, it was not. So I stopped that as well after a year, and I just started this very slowly. And it's been great because the flexibility is really what I needed, and I get the brain power that I wanted as far as learning new things, and the business aspect is great. All right, so light's done. Now we're using Antiox. It's an advanced antioxidant solution enriched with peptides and hyaluronic acid. It's great for all skin types. So that hyaluronic acid is the volume producing component that's also in filler and a bunch of over-the-counter products. It's kind of a buzzword nowadays with marketing. So we're going to dab and hold in a tight grid pattern. So dab and hold. That looks pretty good. So I just want to be kind of regular about how I do it. Oh, it's looking drippy. So just dab it long enough that you see there's a little fluid collecting. And the reason why some of these you're dabbing and not scraping is if you just dab, it'll make sure that the suction is not pulling up most of the fluid. When you pull, that's when the suction is working, or engaging, I should say. Yeah. So if you ever feel like you're not getting any fluid, obviously adjust this as well, but always check your fluid levels because it won't be regular. As far as 12 patients have gone, so you now have to change all of the bottles. It'll just be very random. Again. I'm sorry, I just pulled your hair. I'm the most awkward human there is. I feel like my customer service, like my bedside manner, is in self-deprecation versus like actual, you know, being professional and such. Take time to bathe the skin until it is saturated, which may require more than one pass. It looks pretty darn good to me. She is dripping, so I just like to, it can be uncomfortable, so I just like to do that. And then it. Now we're at rinse away. Okay? So now you just rub it in and put on sunscreen, and then counsel people to be wearing sunscreen, especially today, because your skin is more susceptible to burning. Obviously, we recommend sunscreen all the time, but you know, whatever, people are human, so just especially today. And as far as your skincare regime, you can put makeup right on, but if you want to wait like at least an hour, if not 12 hours, it'll be better for your skin, because you don't want the makeup to go right into those open pores. And our sunscreen should be over here. Moisturizer and sunscreen. So aftercare, like I said, normal skin regime tonight. Just avoid anything with exfoliative properties for the next 3 days.
Okay.
So anything with any type of acid component, as well as, you know, the cleansers that have little, you know, pieces of sand in them or beads or whatever. Because this is, so you know, this lasts a month, but I think the effects before you have to restart your home regime is a good solid week. So you just be careful. And then you know, people are a little bit red. They look really well hydrated and shiny and voluminous. Is that the word? Yeah.
Yeah.
Mild pinkness, nothing crazy. There shouldn't be any open skin. If people have blemishes that are open, or open sores or open rashes, you should avoid those areas, or have them reschedule if it's bad. All right, my friend.
Thank you.
That's that. You're all set.